Thank you so much for joining me for this interview today.
Yeah, glad to be here.
Awesome. So for those of you watching, this is Dr. Brian Bucca. He is an optometrist specializing in diabetes eye health. So I'm just going to ask you a few questions today. The first question is, so most optometrists do not specialize in diabetes eye care. So what made you decide to work in this arena?
Well, I started out wanting to be somebody's underling. I didn't want to be a boss of anybody. During my residency, I did it in the Navajo Indian Reservation, and 50% of the patients there, or the population there, has type 2 diabetes. And so during my residency, I fell into the world of diabetes completely by accident. And I loved the complexity of it. You know, as a doctor, as patients, my heart kind of broke for them.
Mhm.
But that's kind of how I got into diabetes, caring for the Native American population.
Awesome. That's a really unique way to fall into that job.
Yeah, it was a very educational experience, obviously, but
Yeah.
the Navajo has many barriers to care, geographic, historical, between races, and so many more, that people, when they did come in with complications, it was usually very severe. So
Wow. Okay, so following up on that, you work with diabetics every single day in your job, and you see their struggles, them managing their disease. And I was wondering what that experience was like for you, what it's like for you on a daily basis.
yeah. Well, a lot of the patients that come in have varying degrees of retinopathy, diabetic retinopathy, or eye complications from diabetes, from none to mild to moderate. And then when you start to get into the severe, and then in what we call the proliferative or the treatment phases, you can really kind of see the patients start to take it seriously later on in the game. And the very severe forms and the proliferative forms aren't super common, but it's scary for people to hear that these kinds of complications are going on in their eyes. So some patients come in and they've had diabetes, so some of them are hardened, but some patients are very, as you can imagine, very concerned about losing their vision, and the prospect of having that go out of the five senses, that could be a very stressful event for them. So telling patients in a way that's truthful, but also with a compassionate side, is very important. And most of the time it goes pretty well, but it is a hard balance to kind of strike.
Yeah, I bet that is very difficult.
Yeah.
But I admire you for your work and your
Oh,
job.
thank you. Thank you.
Um, my last question is, in your opinion and experience, just because this relates to the topic of my film, um,
Mhm.
how does insulin affordability impact diabetes complications, specifically with eye complications?
Well, if you want to treat your diabetes and do it well, you're going to need insulin. So if you don't have the insulin, or you have insulin but you don't want to use it because then you'll use it all, you're stockpiling it or whatever, you're not treating your disease like you should. And in diabetes, you're lowering blood sugars with that. And if you're not taking that for whatever reason, then your blood sugars get high. And that is what causes all the complications from diabetes, is high and fluctuating blood sugars. So it's a difficult thing to manage. And if your blood sugars are high, and that causes vascular damage inside of the eye, and you can eventually have problems with blood flow, and that's when we really start to see things going on in the eye. And that process of mild, moderate, severe, and into the treatment phases, that's where it begins. And preventing that ramp up, because it doesn't need to happen. A lot of people don't get to the proliferative stages, but if a person needs insulin to really prevent those types of processes going on in the eye.
It makes a lot of sense. I mean, eye health is so important. I think so many people don't realize how their diabetes care impacts their eye health, you know?
It's totally true.
Yeah.
And just to kind of expand upon your point, is the most important thing, if somebody were to ask me, what's the most important thing that you would tell a person that has diabetes about eye health? It's, you have to have the insulin in order to prevent those complications, but you also have to realize that a lot of people who are even in those treatment phases or in the severe stages, they can have 20/20 vision and not know anything's going on. It's a completely asymptomatic disease or process until the wrong thing happens in the right spot, and that's in your central vision part of your retina. 90% of the retina is kind of more peripheral vision, and a lot of things can go on in our peripheral retina and therefore affect peripheral vision without us knowing about it, because we don't see as good in our peripheral vision. But if something happens close to or in the central vision part, that other 5 to 10% of the retina, that's when a patient actually realizes something's going on. And we hope to prevent that, or we hope to catch things before vision is affected. But you can't rely on your vision to tell you when it's time to go in. And that's the whole essence between annual exams and trying to keep up with those annual exams, is that you cannot self-monitor yourself. And that's what people like me do.
Yeah, I think that's awesome. And it's really important. And I think diabetics who don't see an optometrist for their diabetes eye care should consider doing so, just because, again, there are so many extra things that you have to look at when you're a diabetic. So
many things to think about. I mean,
yeah.
I don't have diabetes, but I've been around diabetes for almost 20 years now as an optometrist, and I've seen the struggles with type 2 and type 1. And you have life to take care of, and then this disease that doesn't let go, that doesn't let up. It's always there. And you're taking and thinking about insulin and how much to take. Is just so much to think about on top of everyday life.
Absolutely. Well, thank you so much for joining me today. I really loved hearing your professional perspective. And my film comes out on May 14th, so definitely watch it when it comes out. Share it with anybody you want to. And thanks again. It was lovely talking to you.
Oh, my pleasure. My pleasure.
About you every day, late at night I lie